is a huge honor today to be podcast interviewing a rock star pediatric dentist from Glendale, Arizona, who just had an article in Dental Town magazine, Pediatric Dentistry, Parents and Spoiled Kids, Tips for Dealing with Parents in the Era of Everyone Gets a Trophy. And my God, it was awesome. Everybody's talking about it. And
Thank you.
so your name is Jeanette MacLean.
Yes.
And the most famous MacLean was the lady in the Poseidon Adventure.
Yes, Shirley. Aunt Shirley. No.
Shirley MacLaine. And I did not think you would. I did not think at your age that you'd be old enough to even have seen that movie. Because I know I was a kid when I saw it. And is the story went that
I remember watching it as a kid on TV and just being totally freaked out by it. But maybe that's part of why I love Halloween so much. Is I do love a good scary movie.
And your teeth are so perfect and gorgeous. You could have been a cosmetic dentist. So the question, I hate to ask this the pediatric dentist because I don't want to hurt their feelings, but there's 9 specialties by the American Dental Association. I love root canals. I love retreats. I love extractions. I love everything in dentistry. But the thing, if I had to have your job, I'd quit. I'd turn in my license and go back to my first job. My first job was 10 years working with my father who owned a Sonic drive-in. I would go back to making foot-long chili cheese dogs
with a cherry limeade.
With a cherry limeade before I'd be a pediatric dentist. And I don't mean that in a rude way. It's the only thing that it's just not worth it. There's not enough money in the world to work on a 3-year-old. Even though I love kids, I have 4 boys and I have a 3-year-old amazing granddaughter, but man, I'm going to say this, and this sounds so rude, but it's almost like you're a veterinarian when you're working on a 3-year-old. I mean, it's not like they can tell you what's going on.
Sometimes they even make animal sounds, actually. We had someone meowing yesterday in the office.
So what made you pick pediatric dentistry? Were you just a glutton for punishment?
You know what? It actually started in college. I went to Northern Arizona University, and my last semester of school, I was an assistant for a pediatric dentist up there, and that's really where my love of it began. And I just knew, like, this is what I want to do. This is what I could do all day. And I guess it's good that people like you have that reaction that they have no interest in pedo, because I guess it's job security for us pediatric dentists that other dentists have no interest in treating the kids, because I'm more than happy to treat them. And I think the reason that or why I enjoy it so much is I'm really just a big kid myself.
You're just a big child yourself?
I am. I still have a baby tooth, in fact, so.
Well, that's something that you just learned from doing dentistry for 30 years. You notice that all the people that took my advice in 87, well, there's no permanent tooth underneath that baby tooth, so we're going to have to extract that and do an implant or a bridge or whatever. And then all the people who couldn't afford the treatment, 30 years later, that baby tooth's still there. That's
right. Yeah, I'll be 40 next year, and I still have number T, so it's going strong.
40 years old, and that's it. Is that a new millennial baby boomer thing? Where you confidently you didn't care that you were 40? Most women will not tell you their age.
I have no problem telling anyone my age. I'm proud of my age.
And are you proud of it because you look like you're 21? So you want to show off that you're 40?
Sure. No, so, I think that especially in my field, I feel like I get more respect from the parents because especially when I became a mother, it gave me more street cred, so to speak. When I was fresh out of school, they just looked at me like, girl, you don't know anything. You don't have kids. You're just a kid yourself. I think becoming a mother and having more life experience makes me a better pediatric dentist, where parents will take my advice more seriously because I can empathize with them, and there's definitely a power in that. So I have no problem. I'm actually excited about my 40th birthday. I know that there's a party plan in the works, so I'm looking forward to it.
I agree that, when I opened up in 87, I was only 24, but I was completely bald, and I was always doing second opinions. And these
Yeah.
people were telling me, specifically two dentists across the street that were about 5 years older than me, but they look like young kids. And
Mm.
they were saying, but you know what? He was young. I don't think he knows what he's talking about. And I'd be sitting there thinking, oh my God, they're 5 years older than me.
Yeah.
And I run across the street with my FMX and ask them what to do. And I'm getting their patience because they think I'm older than them. And looking older probably does help a lot in when you're a doctor.
It does. Although in pedo, it does help because it helps me to be female, I think, because I think the kids find me very non-threatening. You know, I don't wear a white jacket. I don't dress up in a fancy outfit to make myself stand out to look visibly or noticeably different than the staff. So we all sort of blend together, and there isn't that fear that the kids get when the doctor walks in the room because I just look like all the other ladies
So
in the office.
the $1 million question that everybody always, the first thing they're always going to ask a pediatric dentist, so I'll just get it out of the way. Should the mom and dad be in the room or not?
Oh, actually, interesting segue. That is my next Dental Town article that it's coming out in November. It's called Parents in the Operatory, Friend or Foe. It's definitely a more common request now for the parents to be present. And when I first started out, you know, it was very much parents out of the operatory. It was very old school. The practice that I joined had been around for over 30 years, and they were very old school, parents out of the operatory. Um, but I think when I became a mother myself, I started to realize, you know, and more requests were coming in for parents to be present. And, you know, that people just don't have that same trust in people in positions of authority anymore, and doctors or police officers. There's a lot of fear, I think, and then also there's the aspect of parents that sometimes feel that if they're present, their child would do better. But I think we all know that sometimes that is not true. Sometimes they're much worse, actually, for the parent. They put on a bit of a show for the benefit of their parent. So they become, you know, the victim, and the parent is the rescuer, so to speak. So it's definitely one of the biggest challenges, I would say, of pediatric dentistry. It's not so much the children. The children, I think, are great. I think it's fun. I like dealing with the kids. I like having the cartoons on. I love having, you know, what better job than to be able to watch Willy Wonka and the Chocolate Factory at work at any time that you want. You know, I really enjoy that. But the parents are definitely one of the more challenging aspects of my specialty.
So, what do you think of the compromise that we do, where we just said, "Look, I understand that with the most G-rated comedian Bill Cosby turned out to be an evil, the Jared from Subway,
Yeah,
and you're right. I mean, I grew up Catholic. I mean, I went to mass every single day, and some of those guys turned out to be
right.
freaks. So I tell them, I understand it's your baby. I understand that you don't want to be outside your baby. So my rule is, as long as the baby can't see you, you're good. But if the baby sees you and starts going for an Oscar, then you're gonna have to leave. And so they
Right.
kind of stand outside the room. They can peek. They can
hmm
peek. But as long as so what do you think about that? Does
We
that work or not really? Or
Our policy is the silent partner, where we ask them to just sit in the corner of the room and be a silent partner. You know, the last thing I like is them up on top of the child, basically, you know, hovering, the hovercraft or helicopter parent, which is definitely a popular term these days. There's a lot of that goes on. That really distracts me and distracts the child. So we just ask them to sit in the corner and be quiet. And for the most part, they'll do that. And you know, you mentioned the priest and Bill Cosby and Jared, the subway guy. You see that all over the news and the media, and that's really, I think, where this fear stems from is the news media, social media. Parents see these stories, and you can't blame them for being afraid or paranoid even. You know, they don't know me, you know, if they're new to the practice. So I totally understand why they would want to be present, and I really don't have a problem with that. And once I finally embraced that and allowed parents to be present more often, I feel like in some ways it just made it easier because the parents were able to watch us in action, so to speak, and develop more of a respect for what we do. because that's sort of the artistry of pediatric dentistry is managing the child's behavior. So
So the next question that everybody asks a pediatric dentist, sometimes we hear that you don't need to see a dentist until the first tooth are rubbed. Some people say by age 1. What do you tell parents when when you can see a tooth, or when they on their first birthday? What do you think's more
it's
evidence-based dentistry time to go in there?
stick with first visit by the first birthday or within 6 months of the first tooth erupting. Um, And the main reason being a third of kids in our state, Arizona, have decay by age 3.
What percent?
One third, 30% of kids already have cavities by 3. So to go with the old rule of waiting to 2 or 3, and a lot of pediatricians are still telling the parents this, that, oh, you don't have to go to your 2 or 3, because maybe that's what they learned way back when they were in medical school. A lot of times they're coming too late and there's already a problem. And, if we get them in earlier, the key is prevention. I mean, no one wants to go to the dentist more than they have to at any age, really. So, for parents to wait until they can visibly see decay, in a primary tooth, if you wait until you can visibly see the cavity, you're talking most of the time pulp and crown, right? And getting them comfortable in the office so that they don't associate us with being something scary, having those fun visits before you have the real work visits definitely can impact how they're feeling about dentists for the rest of their lives. It's really sad when you see a child who comes in for the first time, and let's say they're 5 or 6, and this is their first experience at the dentist, and it's because they have an abscess or they fractured their tooth and they're there for trauma treatment. And it's so frustrating because they associate that negative experience with the dentist, where it doesn't have to be like that. So, and I think starting,
I always cringe when I see all these dentists on social media sharing all these deals that bring your kid in by age 1, or this, or 6 months after, or when they see the first tooth or whatever. Because I always think we should back up even further. I mean, none of these kids were born with Streptococcus mutans, and I still can't believe. I mean, you can go to any barbecue at anybody's house, and you can always find grandma kissing a baby on the lips, and it's like, what, it's like I don't even know if I'll live long enough to see Earth that realizes that kids are not born with Streptococcus mutans, and they weren't born with STDs, and everybody on the entire planet gets and understands an STD. I think AIDS educated the entire planet that you can trade bad bugs below the belt, but I don't think the planet's even barely woke up to the fact that this kid wasn't born with Streptococcus mutans. Why are you kissing it on the mouth?
Well, even if they know that, I don't think it would change them from kissing their kids on the mouth. Is it bad that maybe I do that too?
And it's tough because I
brush my teeth. I don't have any cavities. I chew xylitol gum. I mean, you're right. I think what you're going for here is getting to the mother when she's pregnant to talk about prevention starting then. Is their mouth healthy before they give birth to that child? It would be nice if we get to that point someday. I feel like even today we haven't gotten to the point of the majority of the public accepting the age 1 visit. So I would like to get to that, and then maybe the next step would be getting to the pregnant mom.
I mean, you hand your granddaughter to a 50-year-old dentist, and it'll try to kiss her on the mouth, and you're just like,
that would be a little creepy.
That's like, it's like, you don't, it's just, yeah. So we're a long way from that. So you're a spokesperson for Delta Dental on pediatric stuff. It seems like whenever I see a press release from Delta about anything pediatric, it's always the rock star you. And Delta's probably behind this because they don't want to pay for a bunch of pediatric dentists. They'd rather collect a premium and all the kids come in and have a good checkup, I'm sure.
Well, sure, of course, it benefits them if there's less cavities to treat. But it's also a good public health effort to talk about prevention and starting in.
I love Delta's. It seems like Delta Dental does 10 times more press releases and social media and everything.
They do. In
than
fact,
any other organization I can think of.
They always have fun stuff that you can share on your Facebook page or whatnot. Like this week, we're 3 days away from Halloween. They have awesome stuff for the kids, like coloring sheets and activities for Halloween, and with like a tooth fairy. They have different tips for candy, like what's the best candy for your teeth or worst candy for your teeth, things like that. So, it's especially for dentists, if they can tap into those resources and share them with their patients, it's a great thing to have.
So educate the dentist on the big buzzword you always hear, xylitol. By the way, I got to tell you what I'm doing for Halloween. I've already been working on this. So I
Oh,
bought a gumball dispenser
uh-huh.
where you have to put a quarter in to get the gumball, and it's a quarter. And so I'm going to have that on my front porch. So if you want a sugar gumball, it's a quarter. Then I'm going to have a bowl of xylitol, sugar-free gum that's free. So if you want the sugar from the dentist's house, it'll cost you a quarter for bowl. But if you want the free sugarless stuff, and I'm going to
I
have a big sign explaining it all.
All right. I honestly, if I were you, I'd be a little nervous that my house would be egged and teepeed. So I'm the dentist you want to come to on Halloween because I'm giving out full-size bars of candy.
Well, you know what I think's the cutest? For years, I've always handed out a toothbrush with my name and phone number on it. And I always go to the door and I say, I'm sorry. I said, I'm a dentist. I can't give you candy. So,
Hmm.
but I'm going to give you a free toothbrush. And so many of the kids say, oh, it's okay. Like they feel sorry for me that I'm not allowed to give out candy. And I've had so many kids pet me on like the knee and say, it's okay. It's okay. You don't have to give me candy. They feel sorry for me that
Aw.
they think I can't, I'm not allowed to do it.
You know what? The kids nowadays get so much candy. It is okay to give out something different. I mean, gosh, this week we have so many events and parties leading up to Halloween, but by the time you actually get to trick or treat, the amount of candy that we have is just obscene. So, I've had kids come where that we give them a drink or something, and they're so excited to get something other than candy. So, and that's another thing on the tricks or treat suggestions that they have from Delta Dental is candy alternatives to give out, like toys or, the kids do like to get those things. Although I do give out candy, I'm not going to lie.
So what kind of candy do you give out?
Well, this year we're doing full-size bars of candy. We have just all the
At
terrible
your
things for
house
your
or
teeth at our house. I really wish we could pick up this camera and do. You notice the Halloween manicure. I wish I could give you a tour of our house because we have all kinds of. It's decorated inside, outside. I love Halloween. I go all out. I am the queen of Halloween.
Now I seriously, this is my theory. I don't know. I grew up in Kansas and left there when I got out of dental school, came out here when I was 24 in 1987. And it seems like Halloween is a bigger event in Arizona than Kansas. And my theory is in the desert, we live through this 115 degree every day. And I think what's so cool about Halloween, like this morning, is the first swim of the season. I had to put on my wetsuit
Yeah,
to
it
go
was
swim.
chilly this
And
morning.
so Halloween is the dawn of, oh, it's no longer 120 degrees every day. And then a month later, it's Thanksgiving. And then it's Christmas. And then it's New. I mean, this is just
Yeah,
the best time to be in Phoenix. And
it is.
I think that might be part of why it is a much bigger event out here.
I would agree. I know for me personally, in July when it's 115 degrees, that's when I start to get what I like to call Halloween fever, where you
Yeah.
just start seeing the stuff in Michael's, the beautiful orange and black colors, and I start to get really excited and think about what's my costume going to be, what new decorations am I going to get this year, and I just start to get really excited about it. But I grew up in New England, actually. I moved to Arizona in high school, and for
We're in
me,
New England.
um, most recently, we moved from Connecticut, but I lived in upstate New York, Massachusetts, and Connecticut, each for 5 years. People ask if my dad was in the military because we moved so much, but actually he worked for General Electric, and that's where they had their different headquarters. So APS is what
And you
moved
know
us
why
out here.
GE is my favorite company?
They bring good things to life. I
Because
don't know.
it was the only publicly traded stock listed in 1900 that was still trading in the year 2000.
Oh, wow.
499 other companies passed away, usually ran over from behind, because every
Mhm.
company, when there's a new technology or new product, they're so worried about how they save their old product
Mhm.
that another company that doesn't have all that emotional baggage just comes and mows them down from behind with the new technology.
Mhm.
And I even see that in my company where something new comes along and they say, well, they can't, we shouldn't do that because it'll hurt the magazine. I'm like, well, we're not about a magazine.
Hmm.
And someday there might not even be magazines. So GE was the only one that made it from 1900 to 2000. That's an incredible story.
That is a
But I
fun
was going to
fact.
guess that your dad worked for IBM because IBM does not stand for International Business Machine. It stands for I've been moved. And they were up there in Rochester, so that's why I thought I was
Ah,
going to go there.
yeah. Albany is we lived in Del Mar. I don't know how familiar you are with upstate New York, but yeah, we lived in Del Mar and then Pittsfield, Massachusetts for 5 years, and then Trumbull, Connecticut, and then we came to Phoenix.
And how did
But
and what made
I missed the fall. That was the point of that was that I missed the fall. I missed the colors, um, and just that feeling you get when the seasons change. And I think that kind of sparked my love for Halloween.
so what candies are better or worse?
For your teeth, you want to stick to things that, of course, obviously the xylitol products are sugar free.
Well, review xylitol because a lot of dentists tell me that they're not sure. They're not as on top as they would. What
True.
are
Yeah,
brands?
there's mixed research on whether or not there's an impact, but I do believe in the effectiveness of it helping to prevent decay. I mean, um, you can get it in various over-the-counter chewing gums that you can get even in the grocery store, although those have a lower content of xylitol, or you could get some even into your practice that you can sell, like mints and chewing gum. Like Spry is one that we like to carry. Elevate Oral Care has a line as well of xylitol products, but
So
that would be the
Spry
best.
is just spry.com, and the other one's Elevate Oral Care.
Elevate Oral Care also has great xylitol products. So those are two of the top ones that I can think of off the top of my head. And then in terms of if you're actually going to have candy, you want to have chocolate or something that's going to basically melt away and not linger in your mouth. And then if you want to have the absolute worst thing, you want to go with something sticky or something sour. Or you can combine the two evils and have a Sour Patch Kid and sticky sour and really mess up your teeth. So I would go with the chocolate bar over the Sour Patch Kids for Halloween if you want to protect your teeth. But honestly, I have a little bit of everything, and then I go and brush and floss really well and try to get everything out of my house. At least a week after Halloween, I try to cleanse and get rid of everything.
Oh my God! I raised four boys. You couldn't even get them to stop trick or treating until the pillowcase was completely to where they couldn't even drag it. They wouldn't want to go home.
Ah, I'm proud. Very good. Yeah, and the pillowcase. Yes, that's old school. I like that.
This is Dentistry Uncensored, and I think I built a career because I never gave a lecture to where I was trying to make friends and influence people. I was there thinking, the problem with the doctor is all the staff tells them what they want to hear. The lab man's afraid of them. They're never going to call. The lab's never going to call and say, man, you're a shitty dentist. Those preps are horrible. There's no room. Everybody's always telling the dentist. They're always sucking up to the dentist, telling what they want to hear, and no one stands up to him. So I thought, my job is to go out there. If I really love these guys and I really want to help them, I'm gonna be brutally rude to them. And here's my brutal rudeness to dentists is that we keep hearing that up to 8% of emergency room visits are dental related.
Hmm.
And every dentist listening to this podcast is open Monday through Thursday from 8 to 5. Don't you think we share some guilt for that, or do you not think so?
I definitely think that you make a valid point. It would be nice. The problem is people are going to the emergency room with their emergency issues, but there's other factors. Obviously if we have bankers' hours, where are these people supposed to go? But you do start to see more of these emergency clinics popping up. I know there's one very close to my office that is open, and they're open nights and weekends. But
who is that? Is that a Eric's franchise where he's getting dentists to collectively? Because I think that's
off the top
one.
of my head, I don't know the name of the office, but it's at 59th Ave in Union Hills. But it's a after-hours emergency dental clinic. So I mean, I think there's value. It's like pediatrics now. There's Good Night Pediatrics. You know, it seems like no emergency happens until after 9 p.m. is the joke with children. So to have a place that's actually open at night, I mean, that's smart because people want that. People are going to seek that out. But the point I was going to make is, you know, in Arizona they took away the adult benefit through access. So instead of being able to go to the dentist and have a rotted tooth extracted or treated or whatnot, instead they're having to go to the emergency room, and in the emergency room all they're getting are pain pills and an antibiotic. And you know, it's not fixing the problem comes back. I think that's there's some blame in that as well. It's not just us having the banker's hours, but
Jeanette, I kid, when I tell you this, you're not even going to believe me. I had a patient walk in with a 2 foot by 2 foot X-ray of their head and two bottles. One was Percocet and one was Penvk. Somebody took just a lateral 2 foot by 2 foot X-ray of their head for a toothache, and I always wonder to myself, why aren't we dentists like through Delta, or we got two dental schools? Why don't we at least go to the emergency rooms and start residencies or something? Because
that would be smart.
A emergency room can handle a heart attack,
Yeah,
but they can't even take a picture of a tooth.
Yeah, I definitely see that all the time where parents will take their kids to the emergency room. Sometimes they don't think to even call us. We have a on-call service for patients of record, active patients of record. It can't just be Joe Schmo out of the, you know, did a Google search and called us up. It has to be an actual patient, but they can call me. I've had calls at 4 a.m. for, you know, my child is crying, this and that, or 9 o'clock at night, oh, they slipped in the bathtub, they chipped their tooth. So people can access me that are my patients, but, you know, I don't know where I was going with
What about the emergency rooms?
Oh, yeah. But I think it would be smart. I like your idea of having, you know, especially with the two dental schools now in the state, it would be smart to have an emergency residency or some kind of emergency room presence. I know when I did my training in Las Vegas, we did a rotation through the Children's Hospital, and you know they really made good use of our presence there because we were able to go and do a dental evaluation of kids who, you know, say were there for chemo and checking their mouths, or kids that came in due to I saw a child that had a fractured jaw, you know, things like that that they can't diagnose but a dentist can diagnose. Or you're just not wasting the patient's time and the hospital's resources.
So do you use amalgam in your office? Do the modern day yuppie millennial parents allow amalgam, or is it all got to be
Yes,
plastic?
some of them do, and especially the ones where their insurance only covers amalgam, which is interesting. All of a sudden, it's fine if that's all the insurance will pay for. But the majority of what we do are composites, but we do amalgams, you know, if they're heavy grinders or if the behavior doesn't allow proper moisture or blood control, we still offer good old-fashioned amalgam.
And what do you think? You're going to turn the big 40 this year, and so you've been around a long time. What lasts longer in pediatric mouths, because amalgam or composite? What would you say?
In terms of what lasts better?
What's a better restorative material as far as longevity, lasting, recurrent decay?
You know what? We really don't get a lot of failures with our composites, but it's probably because the teeth are exfoliating.
So
But
okay,
I
so
see
I'm gonna.
both materials. You know,
So
I
you're
think
probably
you see more of the permanent teeth. The amalgams will last longer. I just don't get the luxury of seeing that because usually the tooth I restore is gone before it can fail.
okay. I want you to answer this question as like I was a patient, because you're talking to thousands of dentists and probably very few of them are pediatric dentists. And this is the question mom and dad always ask. Well, why should we fix them? They're baby teeth. They're gonna fall out anyway. What would you say to me? How would you say that to me if I was a parent? Well, Jeanette, I mean, come on, they're baby teeth. They're all gonna end up
Right.
at the tooth fairy's house anyway. What I don't even why even
Yeah.
spend
I,
the time and money.
I hear that response probably at least once a week. And what I tell them is your oral health is part of your overall health. You know, that cavity is bacteria, and the bacteria can spread. The little cavity can become a bigger cavity that can go into the nerve and cause an infection which will could affect your overall health. You could even end up in the hospital from an abscess. So, that's the main reason is it's part of your overall health. Another way to get them, especially with the dads, is to go after the financial aspect. If we're just extracting the rotted baby teeth because they're just baby teeth, then you have issues with space loss, which create orthodontic problems, which are really expensive to correct later. So there's a value in having the teeth are there for a reason. They're there to hold space for the permanent teeth. The child needs them to chew and to talk, even just for social reasons, to have that cute little smile. I mean, you don't want them smiling and having a mouthful of brown holes.
And if you were talking to kids that were juniors and seniors in dental school, one of the most common questions we always get from kids is, should I do a residency, or should I specialize, or should I go and get a job in general dentistry? And part of the specialty, I've always wondered, I've lived long enough to see like OBGYNs and gyns go from all males to almost all females.
Mm-hmm.
Really, I don't even have a patient anymore that's an OBGYN or gyne that's a man.
Mm-hmm.
And do you think pediatric dentistry is following that route? Do you think if you were a man and you were a senior in dental school and you're thinking, I'm thinking about being in pediatric dentistry, do you think being a man at 24 that maybe that's not a good idea? Or do you not see that being a factor at all?
I really don't think it's a factor at all. I think there's benefits to either gender to be a pediatric dentist. And what I hear from parents is I will have parents that tell me that one of the reasons they chose me is because I am female. So I will hear that. But then I'll have parents who say that the child does better with a male doctor. So, I don't think that the specialty should be specific to female doctors. I think male or female, you just have to be good with children and patient.
That's interesting, because I really have been wondering that. Because like I believe, for like my four boys, I believed a woman doctor would be more touchy-feely, caring, better with my babies than some man.
You know what?
Especially if the man reminded me of me.
Now that you put it that way, honestly, when we picked pediatricians, I actually picked a female pediatrician, so maybe I am biased also.
So you're admitting you're a sexist pediatrician right here on the Dentistry Uncensored show. But no.
Can we rewind that?
But yeah, I think it's something that you got to think twice about. I would. I don't know. So how long was pediatric dental school?
The residency,
Yeah.
it depends whether you get a master's or not. For me, it was 2 years. And like I went to a hospital-based program, which I really enjoyed because, I went to University of Southern California for dental school. I got a ton of pediatric dental clinical experience in dental school, definitely above average. There's some pedo residents that come in and they've never even done a stainless steel crown. That kind of scary. You mentioned earlier of what students should do in terms of whether or not they should specialize. You know what I think that they should offer in the dental schools is they should allow all of the dental students to do externships where they rotate through all of the different specialty practices, from public health or general practice, pedo, or all of the different specialties, so they can see what they actually like before they commit to a specialty. Because how do you know you're going to like it if you've never spent a day in that setting?
So does the modern day pediatric dentist get more referrals from a pediatrician because, the babies just come out versus, from a general dentist? What's your mix of referrals from pediatricians and OBGYNs delivering babies versus general dentists?
Definitely our number one referral source, other than the internet, are pediatricians. That's our top referral source. And,
so the internet's bigger than pediatricians?
When people write on their health history how they found us, the number one thing that we see is an internet search. And then number two would be their pediatrician specifically referred them to us.
And then general dentists would be last or third?
Friends and family.
Friends and family.
Yeah, and I think that that has changed. I think maybe this we're allowed to be politically incorrect on your show, but I think a lot more with the economic downturn, I noticed more general dentists doing their pedo in-house. Um,
I would start selling drugs before I start doing my own pedo. You know that Breaking Bad, how that teacher started making his own meth? I would take my lidocaine and start learning how to convert it to cocaine
See,
and then
I would
sell
have to refer to my husband on that one because he's the Breaking Bad viewer. I'm more of a Real Housewives. Do you watch the
it.
Real Housewives?
Oh, the Real Housewives of Miami and all
Of
that stuff.
all of the Real Housewives. I love that's my guilty pleasure after a hard day of dealing with parents and screaming kids. I enjoy
And you
just
know, and you
really
know,
bad reality TV.
and you know what I tell all my guy friends who moan about their wife watching Miami Housewives or LA Housewives or that. I said, dude, I said we watch football, and I have no idea why I went to Arizona Cardinals to beat the other team. Why? Because we're in a different colored jersey than the other one. At least when you watch Real Housewives, you know why Mary's mad at Amy. You know what I mean? At least there's some intelligence behind it. There's no intelligence in sports. Why you want your hockey team or football team to beat the other team is totally Neanderthal tribalism. It's just I have more respect for the Jerry Springer show than I do me watching the Arizona Cardinals every Sunday and jumping out of my chair when they make a score.
Although there is a lot of mindless fighting on the Real Housewives as well.
But at least
Part
you
of
know
what
why
makes
they're
it
fighting. I
no,
still
I
don't
don't
know.
know. Not always. Sometimes they're just fighting to fight.
I have no idea why the Cardinals are trying to beat the other team. I have no idea. It must be the incentive program. Do you ever are you using ever glass ionomer, or is it just mostly
Yes, not for say a final. I've seen a lot of failures that will come in that I have to replace where they use glass ionomer for say a class two as the actual final material they place. I use it to cement crowns or I use it as a liner, but I don't use it just for filling because they tend to leak and wash out. I use good old flowable composite on the primary teeth, and I use a packable composite for the permanent molars.
so then let's go to the controversy since it's Dentistry Uncensored. There are some dentists out there saying that some of the materials we use in pulpotomy could be carcinogenic and that you shouldn't use formicresol or when I got goes Creston and formicresol, and that now you should use calcium hydroxide or the stuff that
NCA.
yeah. So specifically to formicresol and Creston, are those toxic and should not be used, or
I
are you?
I still use formicresol, and as you probably heard all over the news this week, apparently the bacon I had for breakfast is gonna kill me too from colon cancer. I feel like we're so over inundated with this. Everything is toxic, apparently. Now, oh, the BPA and the fillings or the sealants, and oh, the mercury in the amalgam fillings is going to give you autism. There's so much. I just get. I know the good old formicresol pulpotomies for decades have performed beautifully, and that's what we still use. And I have no concern with it.
So then the other question is, we had a person saying, when you go to a pediatric school, that some schools that there's three different kinds of pediatric residencies and beliefs. One's hug 'em, one's drug 'em, and one's slug 'em. Hug 'em with praises and fun, but sometimes it doesn't work. Drug 'em with sedation, but many parents don't like the use of sedation. Mild sedation, nitrous oxide, moderate sedation has risk and can be done in general dental office. General sedation is done in a hospital and can be very expensive. Or slug 'em behavior with a hand over mouth, a papoose board. I want to ask you specifically about the papoose board. Do you use the papoose board? I mean,
Oh,
sometimes do you
yes,
have?
yes, I do, and only for these situations if they're under oral sedation, because I don't want them to roll on the floor onto their face when they're sedated. And then let's say an emergency situation where you can't sedate the child. And interestingly, with some of our special needs patients, I know this might sound bizarre, but some of them actually like the feeling of being wrapped. Or have you heard of the weighted blankets? I mean, there's all
Yeah,
these like
yeah.
So some of them we'll wrap
Do you
them in
use
the
the weighted
papoose.
blanket?
We use the papoose. But or actually we use our lead apron for the the X-ray apron. Some we have some patients with the sensory issues where we will put the leaded apron over them. And we don't have a weighted blanket, but that's a good substitute. That's my tip of the day.
So on a percentage base, I mean, and this is kind of bizarre because it seems like if a general dentist refers you the patient, it's probably going to be a nightmare patient. I mean, the most
Not
difficult patient,
not
as opposed to
necessarily.
if a pediatrician sent just 100 kids that were just because they were born, you'd have a full range of kids. But it seems like if you got 100 patients from a dental office, they probably already had tried or attempted, and it wasn't going good. So it'd probably be more difficult. Would that be correct?
Yes and no. I mean, sometimes they're sending them because they just don't want to work on kids, period, and maybe they treat the parents, so you get that. But then you also get the ones where they've tried unsuccessfully to do some amount of treatment and not gotten anywhere. But you know what's surprising is they don't necessarily do terrible in our office, even without sedation. Sometimes just them walking into an office that's specifically pediatric, it completely changes their behavior because they feel more comfortable in that setting because they see all the fun games and we've got the TVs on and they feel more at ease and also being able to see the other children there. We have an open bay. I'm a big believer in the open bay and then modeling their behavior after their peers.
Sure. All
Uh,
monkeys, apes, dogs, cats, they all model the next guy.
yeah, but I see both. They could be a nightmare patient or they could be just perfectly fine and just need to be in a more child friendly setting.
So in an open bay, do you do the nitrous or the sedation in the open bay, or all those go to a special room?
Those are in a quiet room.
Yeah.
Politically
Quiet,
correct. The quiet room.
quiet room.
Or as some parents call it, the padded room. Oh, I noticed we're in the padded room today.
So then if someone's going into the quiet padded room, is it what would be the percent of like, I mean, what's your go-to? Is it more nitrous? Is it more a cocktail drinking? Is it more, twilight sleep, oral sedation? And if you do general sedation, do you do that in your office or do you go to a hospital?
The majority that I do is with nitrous oxide. I love nitrous oxide. We use that for virtually everything. I think it makes the visit easier for the child. It
I
makes
do
the
too.
visit
I love
better
it
for
so
us.
much. I love it so much. I installed it in my front room.
Smart. That's your tip of the day. We're going to work on that.
And I'm kidding. I'm kidding.
Yeah, I always joke with the parents when we do sedation. It's a BOGO. You get a cocktail too, and they laugh.
So my job is to guess the questions the viewers are listening while they're multitasking on their commute to work. What percent nitrous oxide do you put it on?
We usually start at actually pretty low at 30%, and then the highest I usually go is 50%. But I have friends that will crank it up even higher than that. But usually between 30 and 50% is typically where we're
And
at.
now the new machines. I mean, back in the day, in '87, you could buy a nitrous machine that go 100% nitrous, but now all the new stuff, the highest you can turn it is 70%.
Right. Yeah, they have those safety features and the
So have you
yeah.
met the oral surgeon in North Scottsdale that came out with a new nasal cannula nitrous
I
oxide?
saw that. Where did I see? Did I see that at the? I might have seen that at the Western Regional. We thought about that. But you know what's interesting in pedo having the big old-fashioned hood. There's a big safety factor to that because it really helps keep stuff out of their eyes.
Hmm.
I think you would have to be there and see what I mean, but especially when you have the rubber dam frame, we put sunglasses on the kids, but just having something that sort of props it away from the eye area, I mean, there's definitely a added benefit in having that. So we still have the old school.
And a lot of my viewers, when you said rubber dam, they'll say, "What rubber dam? What's that?
I
What is a rubber dam?"
That freaks me out because I can't imagine, whenever we can get a rubber dam on, we use a rubber dam because I mean one of my paranoias is in pedo is a child choking on something. So I love having the rubber dam because that's a fantastic CYA feature.
My only paranoia with a pedo patient is that I have to work on them. Um, I don't understand why dentists don't use a rubber dam because number one, I never place a rubber dam. I mean, I numb them up, and then when I leave and I come back in, the
Yeah,
Jans put it on. I mean, when people
true.
say
Yeah.
I don't like to put one on, it's like, well, I don't put one on either.
Maybe it's just because they think it's faster. I feel like makes it faster just being able to isolate things, especially on a child. Their tongue and everything is just it's all in the way. I can't imagine not using a rubber
Well,
dam.
you just walked into the next question. You said isolate. So what have you ever used the isolite? Have you ever tried that?
You know,
Isolite?
we thought about trying that. I have friends that love the isolite. I have a good friend that I went to residency with in Reno who swears by the isolite. Maybe
It's your
we'll try
friend?
that one day.
It's your
Yeah,
friend? Hey, you're 40. How old's your friend?
I think she's probably 41. No.
Huh? Because I think one group that falls under the isolite is it's not just the isolation and suction, it floods the whole mouth with light. And I noticed ever since I started turning like 50, I need my readers all the time. And I
I
um
know that's
I
coming.
I changed my iPhone to the 6 Plus screen just so you know. I love the isolite just because when you're 53, even wearing 3.8 magnification, just
Hmm.
having all that damn light in there just helps old people to see.
That's a very good point. Yeah.
Yeah. And I also, all the people that love isolite, and they're also the same group that loves the headlamps, and they're always talking about how magnification and light are so important, but they never seem to address the obvious. And it's because I'm old and I have a stiff
I've
eye that
heard
doesn't
that's coming.
adjust. Yeah.
Another friend of mine is a optometrist, and she's been teasing me that it's coming, Jeanette. Next year, get ready.
My
You're gonna
optometrists
your
always get mad at me when they come in as patients because I always ask them the same question. And one of them snapped at me there and he says, Howard, you've asked me that question every 6 months for 20 years. I always say, are you sure putting on a reader doesn't make my eye muscles relax and not work out and enhance me to be seeing less? Because it seems like ever since I've been wearing readers, maybe if I didn't wear them, I'd force my focus muscles around my orbiculus oris and all that to be in better shape. And they go, Howard, no. And I say, yeah, but you're an optometrist, or you're an optometrist. And they go, Howard, it's the number one question with all eye doctors. And no, readers don't make you more blind. They don't. But it always seems counterintuitive because it seems like if I was straining my eye trying to focus, it seems like those muscles around your eyes would be working out all the time.
But I would worry that you'd probably just get a big old headache. Like I notice now when I use my magnification that I'm getting more headaches or dizzy from focusing from, the regular lens to the magnification lens. And I'm in denial right now of whether that's
It's
because
just a
I'm
river
turning
in Egypt.
40. My friend's like, oh, here it comes, Jeanette. Yep, that's why those glasses are bothering you. I'm like, no, no, no. I think they're too tight. I'm going to have them loosen. I get like red marks right here after I wear them too long. So I'm in denial.
So what? So give us the low hanging fruit from your amazing article in Dental Town, August 2015. Pediatric dentistry, parents and spoiled kids, tips for dealing with parents in an era of everyone gets a trophy.
Ooh, well, what would be my big takeaway from that? Is that
Yeah, well, tell the
asking?
listeners who didn't read that article or see it or need to go back and read it. What were your points in that article?
Well, I think dealing with kids today is very different than dealing with kids 10 or 20 years ago because our parenting style has changed. You have more of the helicopter parents. I assume everyone knows what a helicopter parent.
No, no, I heard it from you first. You're the first time I've ever heard that.
Really?
Yeah,
Maybe,
helicopter
maybe it's
parent.
because your kids are older, but a helicopter parent is someone who hovers. See if you can see me hovering. So they're just overly involved in every little thing that their child does. It's like over parenting, so to speak. Just look
Oh,
at
I know.
even going from when my son was born, he's 5, to when my daughter was born and she's 3, just the products available in that 2-year span are ridiculous. There's like covers for the shopping cart and the pads for everything. Like it's just almost It's crazy.
You know how
Remember the good
different
old days where you played in the dirt?
you know how different it is. So I had these three friends in grammar school: David Hornberg, Andy Wimsett, and Mark Boardlawn. And sometimes after school, I would go home with them and spend the night with them, and go back to school the next day. And I mean, we didn't have cell phones. I didn't even ask my mom. I mean, I don't even know if Mrs. Hornberg called my mom and told. I don't even. I mean, my mom. I mean, back then we used to get up on Saturday and we'd walk down Sleepy Hollow, and sometimes wouldn't get back home till the street lights came on.
Right. Yeah.
And now, if you did
that
that,
was how I was.
you'd probably go to jail. In fact,
Yeah.
you want to know, I would never say I'm trailer trash, because I was barn trash. My pedigree would have to marry up to get into a trailer. Okay. And, we used to, you know what a Farran family vacation was? We'd pile into a station wagon, and
Without a seatbelt.
without seatbelt, me and my five sisters would play Monopoly from Wichita to Disneyland, while mom and dad were up in the front seat driving, splitting a case of Old Milwaukee.
Yeah.
Pretty much most of my childhood was illegal. And so yeah, I understand the helicopter. I mean, I go through this all the time, moving car seats. One of the sons going to take Taylor, and we're moving all this car. And I'm like, she's 3, just put on a seatbelt. Dad, that's illegal. That's a felony. It's like, wow. I mean, it's
Yeah.
really changed.
Yeah, parenting has definitely changed. And why has that happened? I don't know that there's one exact answer. I think that I guess we've kind of become this big brother society where everything's being watched and recorded and judged. There's a lot of mom predators, maybe is a term you haven't heard of
I've
before
never heard of
either,
that
but
term either. Helicopter parents and mom predators.
a
What's a
mom
mom predator?
mom predator. It's like everyone's trying to one up each other and be the best mom. We're in all the activities, and I'm so Pinterest perfect. When you post online all these pictures of what you're doing, and I'm equally guilty of these things. I mean, I like social media just as much as the next person, but there's this I think there's a pressure that we put on ourselves as moms to be the best and to give our kids the best opportunities and chances, and it can be a little bit overwhelming.
Now, what's your dental office website?
Teeth and braces.
Kids Teeth Braces. Or now, are you by yourself, or are you in a group?
I am not by myself. It's a small group practice. I'm the only full-time doctor, and then I have a business partner. The practice was actually started by her father many moons ago, and she works 2 days. I work 4 days, and then her
Is
brother.
she a pediatric dentist too?
She's a general dentist, actually.
Okay, she's a general dentist.
And then her brother is dual trained pedo ortho, and he now specifically does just orthodontics. It's Arthur Orthodontics. So that's us.
I want to ask you a
operation.
question, and I hope you don't think it's sexist, and I'm just asking it because I get a lot of emails at howard@dentaltown.com. I want you to address this, because you're a very successful pediatric dentist. You're a legend in my backyard. Delta chose you. I mean, you are. You're an unbelievable person. Yeah, you are. You're an amazing person. You're an amazing leader. Delta picks you as their spokesperson. My friends in Glendale think you're a rock star. They really do. But a lot of younger girls are asking this question that, as a man, I can't answer. And they're saying, "Man, I bought in this practice, and the old Howard guy would tell the 5 women, do this, do that, and they'd all jump." And then I gave this guy $600,000 for the practice, and as soon as he left, I said the exact same thing, and they looked at me like, "Are you kidding me? Is that true? Is that an excuse, or is that true? Is that? I mean, are you ruling that?"
It's true.
It's true. Okay, so I can address it. Because, can you talk about that a little bit, and how you deal with that?
Talk about this a lot, ironically, because as I
what's
mentioned,
that? What'd you say?
we talk about this a lot, ironically. Sorry, my Britney Spears microphone.
Who's we talk about?
Me
Who's we?
being myself and Mandy Dates, who's my business partner. So her father, Joel Arthur, which if you're from Arizona, a lot of people know that name because he was one of the first pediatric dentists in town and really well known and well respected. But yeah, he's the kind where if he said jump, everybody jumps. So we joke about how if he were coming to the office, all of a sudden people were cleaning the microwave and throwing trash. And
I know.
all the elves were, "Oh, Santa's coming." You know, but often when we say, "Hey, why don't we clean the microwave?" You get kind of a look. It, I mean, I
So
don't.
you admit it's true. So you're a
I do.
40-year-old business owner, pediatric dentist for over a decade, and you're saying you're going on the record that it's true that women staff treat male bosses different than female bosses.
I'm sad to say that it's true. I actually brought this up recently. I was at the Women in Dentistry function put on by
Right.
the Arizona Dental Association, which was a fantastic event. Shout out to the folks at ASDA. And
Kevin Earl is amazing. I had dinner with him last week, and his number two guy, Terry Zalowski, just
yeah,
class acts.
so
And Delta's a class act too.
yes.
I can't. I get so mad when people get mad at Delta because they didn't cover something. I'm like, dude, if you had it your way, you'd get $1 million for a crown. You'd work on Monday on one patient. Don't quit griping about checks and balances. But continue on the.
But yeah, they put together this great organization, Women in Dentistry. So basically, to be networking or a resource for women to ask other female dentists, how do you handle things in your practice? And what you're talking about is the question I raised for the president of the ADA, the president-elect Dr. Summerhays.
Oh, I love her.
How do you? She's fabulous. How do you deal with that? And what she brought up, and it's definitely, it's tough. A lot of times we are more friends with our staff, and there's less of that boundary where maybe with a male boss owner and then the female staff, maybe it's easier to draw that line, whereas we are seen more equally and more as a friend. But part of it, I'm a people pleaser, and I just want to have fun. I want people to like me. I want to be everybody's friend. So it's probably my own fault if I'm being honest. I don't
So
like
how
my
long?
husband tries to, sorry, my husband tries to tell me it's better to be feared than loved. And I'm like, I don't want to be feared. I just want people to like me. So I
Oh,
guess it's my
wasn't it
own,
Roosevelt who said, "Speak softly and carry a big stick"? And
yeah.
maybe if you're their friend, that you're not carrying a big stick. But I want to ask you this: specifics. What is crossing the line between a woman boss, manager, dentist, and a female employee? I mean, are you allowed to go to lunch? Are you allowed to go to happy hour? Or do where would you say no? Don't get too close, or you won't be able to say you need to be here at work every day on time, or I'm going to fire you. Versus she's my friend. She understands my personal life, what I'm going through. She's not going to fire me if I'm 5 minutes late every day. Where is there any hard and fast rules about, or is that just too oversimplistic of a question?
No, I think it's a great question, and I definitely think that it's one where I have trouble making that fine line because I do have.
You cross your own
So,
line.
well, the thing is this, in my practice, one of the things we're most proud of is that we don't have a high turnover of staff. I mean, the average employee has been there actually longer than me. I've been there a decade.
No, that is
We have,
so cool.
we
That
have
speaks volumes. That makes me love you and respect you even more.
I remember your article about that you have to have the 10-year and up, like when you get to that range, that's kind of the magic thing. But anyhow, our office manager has been there 25 years. We have a fabulous dental assistant who's been there 28 years. We have 3 new employees that have been there only in the year-ish range, but everyone else has been there 12 plus years. So we really have become like a family. So then it is hard. I care about them like they're my family, my sisters. We fight like sisters sometimes, but we are there supporting each other like family. Like for example, we have an employee who's in the hospital this week, and we might have our quarrels and whatnot, but boy, did everybody band together to try and help her out because she's this is a mom with a young mom with 4 children who's in the hospital. I mean, we are there to help help one another out. Um, so yeah, that's
Well, one of the biggest takeaways
such a sub.
of what you just said of your podcast had nothing to do with pediatric dentistry. It's if you're a young dentist out there, the questions that come to me about, well, I'm from Oklahoma, and I went back to my town, and there's 2 dentists, and one will pay me 30%, but I have to pay half the lab bill. The other one will pay me 35%, but I got to pay my lab bill. Which one would you take? And I'm like, God, you're so cretin. You don't even know you're cretin. My God, my questions would be, the two doctors, how many times each one been married? A staff turnover. What if one guy's on his fourth wife and the longest staff been there 2 years, and the other guy's been married 40 years and he's got staff that's been there 20, 30,
Yeah.
40.
Amen.
I would rather mentor the person who knows how to build a team, a family that stays there for 10 or 20 years,
Yes.
because in our business, we sell the invisible. Nobody knows what a chrome steel crown is, if it's right. They don't even know if they need it. And if they're
Right.
not sensing family trust, especially with women, I believe this sincerely. It's in the research on it. If women don't trust you, they'll never give you $1. Sometimes men are like, well, I think he's right, but
Yeah.
women
No, you're
don't
right.
trust.
Women go with their gut and you hear about women's intuition. I mean, I think there is a lot of truth in that.
Men have intuition too. It's called Budweiser. Hey, our hour's up, and that's my brand link. That's the average commute that dentists drive to work. But I just want to tell you seriously, you're a legend in my backyard. Everyone from Kevin Earl, the folks at Delta, my friend, all my dentist friends in Glendale, you're just a rocking hot, amazing pediatric dentist, and I just want to thank you so much for spending an hour with me today.
It has been an honor. You are a legend and rock star to me, so I really appreciate you and all that you do, and I love Dental Town, so
thank you for writing articles for us. I mean, you're
Sure.
busier than a
Happy
one-arm
to.
paper hanger, and you still have time to write magazines for me. That is articles for me. That is amazing. Thank you so much for all you do.
You're so welcome. Thank you.
Now send me a box of them chocolate bars.
Absolutely.